If you'll come forward to be sworn as a witness, if you'll stand right there and raise your right hand. Face me and raise your right hand. Thank you. Do you swear or affirm any testimony you give in this proceeding will be the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Thank you. If you'll follow the bailiff now to the ramp that leads up to the witness chair, please watch your step. When you get to the chair, go ahead, have a seat, make yourself comfortable. That microphone in front of you is fully adjustable. You may proceed, Ms. O'Connor.
Thank you, Judge. Sir, can you please state your name, spelling your last name for the record?
David Ciesla, Ciesla.
And sir, where are you employed?
Right now I work for UC Health in Loveland, Colorado.
And what do you do for UC Health?
I'm a surgeon and a trauma medical director at Medical Center of the Rockies in Loveland.
Can you please explain your educational background to the jury?
My education after high school was 4 years of college at the University of Colorado, followed by a year of postgraduate research in California, followed by 4 years of medical school, 1 year of graduate school, 5 years of surgery residency, 2 years of surgery research, and a year of specialized surgical critical care training. All of that was done at the University of Colorado.
And are you still up to date as far as your licensing for being a medical doctor?
I'm licensed in Florida and Colorado.
Back in March of 2017, were you working at a different facility than where you currently work?
Yes, I was working at Tampa General Hospital.
And what role did you have at Tampa General Hospital in March of 2017?
So I worked for the University of South Florida in their medical practice group. I was the chief of the Division of Trauma Acute Care Surgery, and my assignment was as faculty at Tampa General Hospital and the medical director of the trauma program.
So as a employee of USF working at Tampa General Hospital and being the medical director of trauma, what did you do specifically?
My job was mostly split into sort of missions. So as in academic practice, we have patient care responsibilities, education responsibilities, research responsibilities, and in my job as division chief, I had some administrative responsibilities.
What particular area at TGH would you be working in March of 2017?
All of those, the clinical assignments were made according to a calendar. So, for example, when we have to have someone immediately available 24 hours a day and a backup person. We also have assignments to, say, the ICU or the inpatient floor or the clinic. So in March of 2017, my clinical assignments would have been either as the on-call surgeon or assigned to the ICU.
The ICU being the intensive care?
That's right.
Okay. Directing your attention to March 13th of 2017, do you recall a patient by the name of Trevor Summers being treated by you or students that you were supervising at the time that were treating this patient at TGH?
I don't have any independent memory other than what's indicated in the chart, but the chart shows that I was responsible for the people taking care of him that day.
When a person is admitted to the hospital, specifically sticking with TGH, were records notated as to why the patient was seen?
Yeah, that's part of the medical record.
Is it also notated as to the medications that are ordered and then given to the patient?
Yes.
Is it notated as to the type of treatment that the person receives?
Yes.
And are those the records that you're referring to that would have been notated in regards to the treatment of Trevor Summers on March 13th of 2017?
That's right.
Now, in regards to medications that are given, are all medications that are ordered by a physician ultimately given to a patient?
No.
So just because they're ordered doesn't mean it's actually given?
That's correct.
when you're looking at records of a patient's treatment, are you specifically looking for where those medications are given?
How it works is if you intend to give a patient a medication, you write an order in the chart. That order is listed someplace where the nurse usually can see it, and if the nurse intends to give the medication, they will mark in a different place when and where it was given.
So on March 13th of 2017, was Trevor Summers given a dosage of fentanyl?
That's what
Objection. Leading the witness.
Rephrase.
Dr. Ciesla, do you recall what medication Trevor Summers was ultimately given that he was administered on March 13th of 2017?
Yeah, I don't remember, but the chart indicates that he was given a dose of fentanyl.
And what was the dosage?
If I remember right, it's 100 micrograms.
Is that a standard dosage?
It's typical, yes.
What is the purpose for providing fentanyl, that dosage, to a patient?
Usually it's for pain relief.
What is the time frame in which, when that dosage of fentanyl is given, that it would wear off?
Fentanyl is useful because it's rapid onset and rapid onset, rapid off. So it usually starts to take effect within a minute or two and usually lasts somewhere between a half an hour to 40 minutes.
And per the chart for Trevor Summers, were you able to ascertain at what time that dosage was given to him?
I think the chart says somewhere around, I'd have to look.
Would referring to the medical records refresh your memory?
Yeah, I'd rather do that than guess.
If you could look at that and then look up when you're done not reading from it directly, please.
So the record says that he was given 100 micrograms of fentanyl at 12:18.
Being 12:18 p.m.?
That's right.
Okay. And you said that it's given because it wears off faster. Is that right?
Well, it's given for pain. We choose that one specifically because it acts quickly and wears off quickly. And so when we're doing things like making assessments, we want to have there be like no confounding problems of medications.
So when you are providing this dosage of fentanyl to a patient, is that before you conduct any type of an assessment or exam of the patient?
It depends on the patient's condition. So, for example, if someone came in with extremity fractures and they just can't cooperate with an exam, we'd give them some pain relief so they can calm down and we can get a better exam. It's really all dependent on what the needs of the patient are, honestly.
If the patient is given that dosage prior to an exam, can the exam still be done?
Usually, yes.
Can the doctor or the nurse still communicate with the patient?
Yes.
As to what the patient is feeling in regards to why they're at the hospital?
Yeah, at those doses, our standard doses, yeah, that's all still possible.
Are you able to obtain consent from a patient after having that dosage of fentanyl being given for any type of procedures?
So we get consent judging the patient's response to our questions, not necessarily based on what the actual dose is. So if we give someone if we give someone a dose of fentanyl and they are able to answer our questions and display some understanding, then we consider that consent.
Does that dosage of fentanyl impair a person's cognitive ability in any way?
Generally not.
Does it cause them to be drowsy?
Well, it can. Generally not at those doses, and you assess that just by examining the patient.
Does it impair the ability for the patient to be able to talk with the doctor or the nurses?
Usually not. If it does, then you notice it on physical exam.
Now, I want to direct your attention to an exam that was done at 12:27 approximately by Dr. Bradley Franklin Peckler. What does it mean for a doctor to note in a record that the patient was oriented to time and person and place?
So we do a gross assessment of someone's cognitive function by asking them really, if they know who they are, if they know where they are, and they know what time it is.
What does it mean that if there's a notation that there is a non-toxic appearance?
It's sort of a qualitative eyeball test where you look at someone and you think that person looks sick or they don't look sick. So non-toxic would indicate that they don't look globally sick.
And then a notation indicating that the patient was active. What does that mean?
It's another way of phrasing that someone's awake and moving spontaneously and not sleeping, essentially.
From review of the records, were you able to ascertain the amount of blood loss that Trevor Summers received?
No, not directly. He suffered a superficial injury to his neck. It didn't involve any major blood vessels. It didn't alter his vital signs substantially or his end organ perfusion, things like being awake, making urine, that kind of thing.
Did he require a blood transfusion?
No.
If the fentanyl was given to Trevor Summers at approximately 12:18 p.m., would he have any lasting effects from that dosage around 1:10 p.m.?
Objection. Assuming facts not in evidence. It's not been.
No, that's overruled.
You can answer the question, doctor.
Say again, please.
If the fentanyl dosage that we've been talking about was given to Mr. Summers at 12:18 p.m., would you expect there to be any effects, lasting effects from that dosage around 1:10 p.m.?
Generally not. There may be some residual analgesic effects. Generally, fentanyl wears off pretty quickly as it's redistributed in the bloodstream. And the half-life is pretty short. So we typically think of things like, you give someone a dose of fentanyl, half of it's gone within about an hour or within about 40 minutes to an hour, generally speaking.
What do you mean by analgesic?
Pain control.
I'm sorry?
Pain control.
Pain control. State will pass witness.
Cross-examination.
Good afternoon, doctor. Doctor, you were not his treating physician, correct?
I would say that, okay. I did not provide direct treatment to him. I was responsible as the attending physician assigned to the trauma resuscitation team and a supervising physician to the trainees in the emergency department, like our residents and fellows.
Well, in layman's terms, did you ever meet the patient? Did you ever talk to him?
I have no memory of meeting him. My standard practice would be to have examined him before he was discharged.
So that's your standard practice, but you don't have any recollection of that?
That's right. I have no reason to think I didn't, but I don't remember him at all.
Would you have treated the wound to his neck?
I would not personally have done. We do, like at this institution, our responsibilities cover things like general supervision. So sewing up a superficial laceration in the emergency department would be something I would have done as a general supervising person to someone who did the actual suturing.
And again, you don't have any recollection of this. It's just from reading from the notes.
That's right.
Do you know if the patient had ever requested medication?
I don't know.
Do you know if the patient ever signed a consent for medication?
I don't know.
Do you know if Mr. Summers was Bakerite?
Just from reviewing the chart, I know that it was considered. I don't know if it was ever enacted.
Do you know if he was actually examined by psychiatrists to determine if he should be Baker acted?
I read that I saw that there were psychiatry notes in the chart, but I didn't read them.
Would it matter to you at all if he was going to be Baker acted as to whether you would give him any of these drugs?
No.
In addition to fentanyl, wasn't he also given lidocaine?
Yeah, he got an injection of lidocaine at the site of his wound for anesthetic purposes.
Wasn't he also given a second injection of fentanyl, 50 milligrams?
I didn't see that in the record.
You see the first one, the 100. I'm on page 49.
I gotta make sure I'm on the right page that you are. I'm looking at. Well, mine says page 6,
Sorry.
but I don't know if I'm.
May I approach the witness?
Absolutely, yes.
You take a look at I have. See if that can refresh your recollection.
Well, the one I'm looking at here is an order that indicates that it was ordered but not necessarily given. And here it says that it had expired. I don't know what point that was. At least at the time of this printing, that order had expired. So in the column on the right, generally speaking, if something was given, it'll have an indication that says completed, or the status of that order will be noted.
So what can you tell us from what you recall? Was he given that second amount of fentanyl or not?
Again, I don't recall anything, but just looking at the records, I don't have any reason to think he was given a second dose of fentanyl. It may have been ordered, but it's called the MAR. Doesn't show that he was given it, and this says it had expired.
Wasn't he also given morphine?
I didn't see anywhere in the MAR that he was given morphine. It may have been ordered, but not necessarily given.
And how about oxycodone, Percocet?
Same thing. Ordered.
Again, may I approach the witness?
You may.
I'm going to show you again, see the medical records, that he was prescribed oxycodone and he was prescribed morphine.
Yeah, these were ordered, but were not given.
Do you know why they would be ordered but not given?
It's kind of standard practice to give the nurses a number of options based on what the patient's needs are. So, for example, we often choose a short-acting agent like fentanyl because we want to give a short duration of medication. If we want something to last longer, we would give morphine, and if they're able to take oral agents or we want it to last even longer, we would give oral agents. But usually the nurses, like I said, they have an option of a number of drugs to give depending on what the patient's needs are. And then we leave that up to their discretion.
Doctor, you've testified in court proceedings before.
Yes.
Can you tell us, to a reasonable degree of medical probability, of the doses of medication that was given to him would be totally insufficient to render Mr. Summers unable to waive his right to Miranda warnings?
I got to make sure I understand that. Are you asking me if 100 milligrams of fentanyl would unequivocally make him could you rephrase that?
No, I'm asking it the other way
The
around.
other way around.
I'm asking the other way around. I'm asking, within a reasonable degree of medical probability, can you tell this jury that the dosage of medication given to him was insufficient to render Mr. Summers unable to waive his Miranda rights?
Judge, I'm going to object.
Approve.
Your ruling, sir?
I'm sorry?
You have to announce your ruling? Okay.
Well, rephrase the question.
Okay, I was just, okay, yes, sir. Doctor, you've given us your medical opinion about the amount of fentanyl that was given. Questions were asked about how it would affect him and being able to answer. And I'm asking a specific question within a reasonable degree of medical probability.
Objection.
Sustained.
Let me rephrase the question. Can you give us your opinion about whether the medications that were provided to Mr. Summers, the fentanyl and anything else that was given to him, was insufficient to render Mr. Summers unable to make a decision of waiving his Miranda rights and speaking to the police?
I'll answer that by saying the amount of fentanyl that he was given did not interfere with our physical exam, us being able to get consent to repair his neck or cooperate with getting history and physical. So, I don't really know about the Miranda rights thing, but it didn't interfere with his ability to understand and give us consent to repair his neck.
Well, you asked that question before your answer was you were unqualified to make that answer. Is that pretty much what you're saying about making the specific answer about
You're asking,
Miranda warnings?
Yeah, you're asking me specifically about Miranda stuff. That's not really my thing. But if you're asking if that amount of fentanyl would have impaired his ability to communicate normally with somebody, I would say that amount of fentanyl was not enough to make him or to impair his ability to communicate.
Would you agree with me that communicating with someone, maybe telling medical history or something, is totally different from speaking to law enforcement about whether you want to waive your constitutional rights to speak to them about these crimes that are being alleged?
I don't have an opinion on that, really.
Fair enough. No further questions.
Redirect.
Nothing, Your Honor.
May this witness be released by the state
Yes.
and released by the defense?
Yes.
Doctor, you may step down. You may be released as a witness at this time. Gentlemen of the jury, it is 12:15 and it is perfect time for lunch. I am going to release you to lunch at this time. I'm going to remind you of my previous instructions not to discuss the case amongst yourselves or with anyone else. Also not to do any research related to the case. It is 12:15. I'm going to give you an hour and 15 minutes, which will give you time to get out of the courthouse and get something to eat. I saw on the news this morning that it is National Cuban Sandwich Day, and Tampa happens to be the capital of the world for Cuban sandwiches. There are several places, I'm not recommending any place specifically, but there are several places within walking distance of the courthouse that serve Cuban sandwiches. You decide on your own what you want to eat for lunch. I will see you back here at 1:30. All rise for the jury.